guys, and welcome back to my channel. For those of you who are new here, hi, welcome. My name is Daniela, and for today's video I wanted to do something different. I decided to do a chit chat, get ready with me, all about dental hygiene. If you guys don't follow me on Instagram, you probably and most likely have no idea that I am a registered dental hygienist. And so I went ahead and asked you guys on like the little question and answer poll on Instagram to send in some questions and, you know, just kind of what you guys wanted to know about being a registered dental hygienist. So I wanted to do a video and just get ready, something super chill, and answer the questions at the same time. So if you guys are interested about my day-to-day job as a registered dental hygienist, then just keep on watching. Alright, so I went ahead and did my eyebrows off camera. I feel like that's always the boring step in makeup, so I know you guys don't want to see that part. But of course, all of the information on the products that I'm using today will be listed down below if I forget to mention them as I am doing my makeup. And is it only me, but do you guys always feel like when you do your eyebrows first, you look crazy? Because I swear, I always look at myself when I do my eyebrows and I am like, what is going on? But then when the makeup is all done, it kind of all comes together. But let's go ahead and take a look at what you guys wanted to know about being a registered dental hygienist. So the first question I got was, what is the grossest thing you've pulled out of someone's teeth? If I'm being honest, I don't get grossed out very easily or at all. That's probably why I'm a registered dental hygienist, because I see a lot of gunk and a lot of like things that would make you want to vomit if you have a very light stomach. It's gonna be really hard, by the way, for me to do my makeup and answer questions. So let me just get started and I'll continue. But yeah, I don't get grossed out really easily. It's funny because I'm not picky with food, but the two things I cannot stand are pickles and peanut butter. As you guys saw in my what's in my mouth challenge, or like gets the food in my mouth challenge that I did. And so I don't like get grossed out by anything, but pickles and peanut butter I cannot stand. So the grossest thing that I have pulled out of someone's teeth, first of all, let me just give you a tip.
If you're going to the dentist, I know sometimes you're rushing and you may be like, oh, it's okay, they're just gonna clean my teeth. It's fine if I don't brush them. Please brush your teeth before you come to the dentist. I know you're rushing, but you apologizing for it, as in like, I'm sorry I didn't brush my teeth, doesn't make it any better. I'm just saying.
So, coming from a registered dental hygienist to you guys, please just brush your teeth. Even there's always mouth rinse in the bathroom at every dental office that I've ever been to. So even if it takes you 2 seconds to go into the bathroom, kind of like swish around some Listerine, please, it'll pull out some of like that soft plaque, what we call soft plaque, or basically just like pieces of bread because you just had breakfast. It'll pull it out if you just swish around with some water, some Listerine, whatever you find. Please do that. All right, but I just got completely sidetracked on that question. So to answer your question, the grossest thing that I have pulled out of someone's teeth. Okay, so story time. I like stayed late for work one day because they had asked me, there was a patient that really needed to be seen, and I was like, sure, I'll stay, whatever. I had no idea that he was going to be so gross, and I will forever remember this person. So he comes in, he sits in my chair, and you know, the first thing we always do is ask them if there's anything bothering them or any concerns they have. So I asked him, and he said, well, I just got my wisdom tooth extracted on my lower right over here, and I feel like there's a hole. And I'm like, okay, before I even like open his mouth, you know, I'm like, okay, well, that's normal. You just had an extraction. Of course, you know, there's gonna be a hole. I'm like, are you in any pain? And he's like, well, sometimes, you know, I feel like things get stuck in there and sometimes it becomes like really sensitive. I'm like, all right, we'll take a look. You guys, he opened his mouth and I'm like, just kind of do like an overall, you know, exam. And I like pull his cheek to the side and the hole is revealed. And I'm like, oh yeah, you have a hole here. Like, sure, you know, whatever. Next thing I know, I grab my air and water syringe to kind of, you know, spray the area to dry it up and see what's going on. You guys, there was like pieces of carrot coming out of there. I can't. I was like shook. Like underneath my mask, I was just sitting there like, what is going on? I had like no words for him. But needless to say, you guys, he needed that cleaning, and I'm so glad I was able to help him out, because this poor guy would have been sitting there for however long it took for that extraction site to heal, with like a pound of just food sitting there. It was so gross. And if you're wondering if it smelled, it sure did. Next question is, what are the best toothpaste? All right, so I'm not picky when it comes to toothpaste at all. I feel like it's, you know, patient to patient based. I always try to ask the patient what they're, you know, want the toothpaste to do. If they're having sensitivity, of course, I always tell them to go with a Sensodyne. And depending if they want whitening with it, there's, you know, Sensodyne makes a whitening toothpaste with sensitivity, like ingredients with it too. So it all depends. I have patients that have acid erosion, and in that case, we definitely want to give them some kind of enamel protection. So either Pronamel or Colgate just came out with a enamel health toothpaste, with which we've been trying out at the office, and a lot of people seem to like it. The thing with sensitivity toothpaste is that I feel like over time it stops working, and at that point we tend to prescribe a stronger toothpaste. Basically, it's just a medicated toothpaste, and it works so much better. But of course, that's once you've used Sensodyne religiously and consistently, not just like, oh, I tried Sensodyne once and it doesn't work. You have to give it at least 2 weeks of constant use to see the effects of that Sensodyne toothpaste. So it all depends on what you're looking for. If you are prone to cavities, I want you to use a toothpaste that has a higher fluoride content in it, because fluoride will help you with cavities and also sensitivity. We have patients that, you know, their gums bleed a lot, and there is something called Periodontex that's for bleeding gums, that we've had really good feedback. It kind of tastes gross, I'm not gonna lie, but they just came out with a new one that has a mint flavor, and patients don't mind it as much. But if you've had a deep cleaning before, if you're, you know, come in to do a deep cleaning with me, we usually prescribe that for the first couple of days, couple of weeks after SRP, which is scaling and root planing, which is a deep cleaning, and then we move you to just a fluoridated toothpaste. I hope that wasn't too confusing, but it all depends on what you're looking for. If you want whitening, just know that it's really abrasive and you could have sensitivity over time. So a little tip I tell my patients is, if you want whiter teeth, go ahead and use the whitening toothpaste, as long as there's no cervical like recession and things that can damage your enamel. Go ahead and use the abrasive toothpaste, but always use it in conjunction with a Sensodyne product. That'll just save you so much like sensitivity headaches. You will thank me later. All right, so next question is, why is your sister Adri so pretty? Hi sister, I know you're watching this. Well, you know what? I ask myself the same question every single day. And the answer to that is because God made you So pretty. Next question. Do you feel different when attending to family and friends? Well, honestly, yes and no. It all depends on who it is. I feel like, you know, at the end of the day, I'm still the provider and I still have an obligation to tell you exactly, you know, what I'm finding, whether it's good, whether it's bad, it's coming from a good place. And I feel like anybody that I've seen that knows me knows that it's not me trying to, you know, tell them, oh, you're doing this wrong and here you should do this. It's just, I want everybody's mouths to be, you know, at health. I want their teeth to be good because, first of all, dental care is super expensive. So I don't want my family and friends to be paying thousands of dollars for things that could be so easily avoided by just flossing your teeth.
Do you hear me? Flossing your teeth.
But I will be right back. I'm gonna go do my eyeliner and put on my lashes. So give me 2 seconds and I'll be right back. Okay, so my lashes are on. I primed my face. And let's move on to the next question. It says, how do you like your job and how was the process of getting into school? So first question, how do I like my job? I love my job. I always knew I wanted to do something in dentistry. And for a while, I wanted to go to dental school. If I'm being 110% honest with you guys. But I do not like the business side of dentistry. I don't want to deal with insurance. I don't want, basically I want to just leave work at work. And I feel like if I wanted to go to dental school, if I went to dental school, I would want to have my own practice and not work under someone else. So with that comes a lot of business talk, a lot of, things that I just didn't want to do. So I did dental hygiene because it still gives me, that dentistry side without having to worry about coming home or, thinking about work on a Sunday, an emergency, and I have to go into the office or anything like that. So that's the freedom that you get as a dental hygienist. You make your own schedule basically. And you can either work full-time if you want, or you can work part-time, work 1 day a week if you want. There's tons of places that don't really care to have a dental hygienist that's full-time at their office. They may just need one person 1 day a week because they have the other days covered. So in terms of that freedom for my schedule, I really love that about my job, and that I don't have to come home and think about work. It's a great feeling. And the other part that I love about what I do is I get to meet so many different people. In one day, depending on the day, I can see 8-9 patients, and it's different conversations with all kinds of different people, which is so nice. Because again, I come home and I just unwind and I forget about work, and then I do it again the next day. Love that patient interaction, and we get to see the patient a lot more than the dentist does. They come to us every 6 months or every 3 months for their cleanings, depending on their recare schedule. So you definitely build a lot of relationships with your patients, and it's just a really good feeling when they know that they're being cared for, and just a really good environment by a really good provider. And they come back, they remember you, and you guys have conversations about whatever you did in the last 3 months, 4 months, 6 months, however long it's been since I last saw you. So that patient rapport I really, really like. And then the other question was, how was the process of getting into school? I think it varies depending on what state you're in. But for me, I already have a bachelor's of science, so I have my undergrad, and I had done a lot of my science classes through for my bachelor's. So you are required to have like basic cell bio, anatomy. You also need, I believe, some chemistry, and electives such as like statistics, English 101. You know, it all depends on the school that you go to and the state that you're in. It can definitely vary, but there are some prerequisites that you need, again, depending on the school that you go to. And then the program is 2 years. That was another question that I got asked, was how long is the program? My program was 2 years, but it's nonstop. Basically, you go to school, you know, from summer to summer. You get like a week off when the semester ends, and for like Christmas and things like that. But basically, you are in school for 2 years full time. Little backstory, we started in the summer, and it was like the first summer course was super easy because there was only one class. They basically give you like an intro to what the dental hygiene program will be, and that's it. When the fall came around, it was like everybody got smacked in the face with how much schoolwork we had to do. And that was another question I got asked, was, is the program hard? Yes, absolutely. It is. First of all, it's super competitive to get in, so you definitely want to stand out. I was part of like the interviewer process at my school when I was in the program. So anybody that was incoming, we did interviews for them, like one-on-one interviews. And that was a lot of fun, actually. I enjoyed just kind of getting to meet people that were interested in the program and kind of just find out, you know, why they wanted to be a dental hygienist. So be prepared for that. If you're applying to a dental hygiene program, you are most likely going to have a one-on-one interview with the program director and somebody else. And yeah, they're just gonna ask you why you want to be a dental hygienist and what basically stands you out from the rest of the applicants. So is it nerve-wracking? Yes, but you can do it. It is not rocket science. It's all about being confident and just knowing what you want to do. If you want to be a dental hygienist, you have a passion for it, go for it. It's a great career to have. I love it. Sorry, there's like powder everywhere. But I'm just setting my face here. So the next question was, any pros and cons regarding your career? So some of the cons are patients can be very uptight. Patients can be demanding, and you know, if you don't work with a team that is a team, that can be definitely a downfall, because the dental hygiene like role, you have to work together. You have to work with the assistants, you have to work with the dentist. It's not just like the patient comes and sees me and they leave and that's it. Like, if you're running behind, the assistant will come and clean your room, so you need to get along with them. If the doctor, you know, needs to come in and do some work on that patient and you need to numb them up, you gotta be quick. You gotta move around. That's one thing that our career is, like our day-to-day basis. We are like running around for the most part, just trying to, you know, depending on where you work, you can get up to an hour to do your cleaning, you know, the recare, or it can be 45 minutes to do x-rays, clean, exam, check the patient out, make sure their next appointment is set up. Like, these are all things that if you're not in the field, you're probably like, that is super easy, but it's not that easy. You know, you're running around, you're trying not to be late for your next patient, make sure your notes are done, make sure that the patient gets the best care. Like I was saying earlier, it's not just, oh, let me be a dental hygienist and then be a shitty dental hygienist, you know. You have to be good, and you have to have a passion for what you do, because there will be days where the patient is upset with whatever else is going on in their lives, and they come in and they take it out on you. You know what? Dental hygienists are definitely therapists. Right, next question is, any tips for someone that's in the program and going to be taking their state board exams? Oh my God, I still have nightmares about like the the NBDHE, you guys. I think anyone that has gone through dental hygiene, like the program, has nightmares about the 2 years that you were in the program and your board exams. Let me just tell you guys, it was hard. So the problem is that, or not the problem, but just like give you guys a little background. The state exam is a 6 to 8 hour exam that you have to take like a center or whatever. And that's one part. There's 3 parts to getting your license. You have that exam. You have a mini like computer based exam. That one is only about like 2 hours, I think. And then there's a clinical exam, which you have to find a patient for. And there's like specific qualifications that they need to have in order to qualify to be a patient for you. That was, I think, like the hardest part, because everything else, you know, it's basically everything they teach you in the 2 years that you're in the program. They really prepare you. At least the school that I went to really prepares you for the exam, the written exam. But the clinical exam was hard because there's so many like qualifications and little things that the state requires for a patient to qualify to be a board exam, like examined patient, and it's so difficult to find. You just need to focus, and basically like what the instructors told us was you get, I think, like 2 hours, 2 to 3 hours to complete the exam with the patient. And my instructors were like, I don't want to see you look up for anything when you're, you know, when the exam starts. You dive in, elbows deep into that patient's mouth and clean. That's all you need to worry about. And that's basically what you do. So that's a little, you know, tip here. Just once you find your patient and you're about to take that exam, focus. Nothing else matters in that moment. You know what to do, and you know, just don't let your nerves get in the way of getting your license, because we've all been there and it is definitely doable. Is it hard? Yes, but you can do it. For the written exam, what are some tips on studying? You know, it's a lot of information. It's 2 years worth of information that they can test you on, but it's all about like the bigger picture. You know, they ask questions very specifically, like in the wording of the questions there is always like little, you know, tricks, or like little hints, I should say, as to what they're asking. If it seems too easy, it probably is. Like, don't overthink it. And I think a lot of the times that's what we all kept doing. We kept overthinking. I don't study in groups. I'm not one of those people that like can study in a group and do good. I need to study by myself and then come together with somebody else and try to like tell them back what I know. So we did a lot of that with my group of friends. We would study separately, and then we would come together and study as a group. It was like 4 of us, and we basically just told each other stories on how to remember stuff. We found a lot of like acronyms and little funny ways to remember eruption dates, the bacteria that it's in your mouth that can cause periodontitis. Someone asked me what was like the hardest class in the program. Periodontics was so hard. Could be because of the professor, but like we loved her, or at least I did. She was a great instructor, but she was hard, you know, so it was just a lot of information. But again, you think it's the end of the world when you're in the program, because everything seems so hard. But once you know, kind of like get out there and know, like, you're confident in yourself, it's okay. I also had somebody ask me what it was like to be, you know, a registered dental hygienist fresh out of school. I'm not going to lie, it was scary to, you know, work on the first patient that I ever worked on, only because once you are, you know, hired in an office, there's nobody like watching you. When you're in school, you have your instructors right there. Oh my god, my eye just watered so bad, sorry. But when you're in school, your instructors are over your shoulders at all times. They are watching what you're doing. If you do something wrong, they go ahead and correct you, or they do it themselves, you know. But when you, sorry, there was like something in my eye. So when you go ahead and like start working somewhere by yourself, you are constantly like, did I do that right? You're like looking over your shoulder, like, is somebody gonna come check my work? So although you don't have your instructor, you know, watching over you, and you don't have anybody telling you like whether you're doing something right or wrong, you're doing everything right. Just take your time. I know time management is like the biggest, you know, issue, the biggest scare that we have getting out of school, because like I said, when you're in school, you have like 3 hours to finish one patient. Well, hey, guess what? In the real world, you may be lucky if you get 50 minutes. So you gotta move fast. You have to like find a sequence that works for you. I, you know, build my own sequence. I start on the anteriors and then I move to the sides, and kind of work my way around the mouth that way. Find what works best for you to move fast when you're in the real world. You know, when you're already doing hygiene as your career, you gotta find something that works for you in terms of sequence, in terms of, you know, the questions that you have to ask the patient, medical history, medications, all as you're moving along to take x-rays, you know, and also like keep a conversation going, so it's not like dead silence and awkward in the room. There's a lot you have to do, but once you get out there and you start working, you find a balance with all these things and it works out. It'll be fine, trust me. Know that everybody started where you started, which is not knowing anything to being a new grad, so it's fine. The doctors, if you find, you know, like if you're in a good office, the doctors will understand that you are fresh out of school, and they will help you too. You know, your team, like I mentioned earlier, is basically your backbone at that moment. On a day-to-day basis, your team, it's not only hygiene team, but just like your dental team as a whole is your backbone. But I've been talking for way too long. Let me just do my lips and I will be right back. All right, you guys, so I went ahead and did my lips off camera. On my lips, it's the Lippie Stick by ColourPop in the color Bichette. I love these Lippie Sticks. For Black Friday, I got 18 of them in this little box for like 20 bucks. It was a great deal. They were having like a 40% off sale, and I literally like blacked out. I bought so much makeup and just unnecessary things, but it was a good deal, so it's justified, right? But anyways, you guys, this concludes the video for today, the little chit chat, get ready with me regarding dental hygiene and, you know, my career as a registered dental hygienist. I hope I answered all of you guys' questions. For those of you who asked me anything, thank you so much for participating and interacting with me on Instagram. If you don't follow me on Instagram, I'll leave my link here for you guys to find me and keep up with me on there. So as always, thank you so much for watching my videos. Please don't forget to subscribe to my channel. I hope you guys enjoyed this video, and I'll see you guys in my next one.